Thanks very much, Rosemary. I'd like to acknowledge the traditional custodians of the land, the Ngunnawal people, and in particular pay respects to their elders, both past and present. And I'd like to congratulate Minister Barr and Natalie on the launch of the Community Sector Development Program today. And as Rosemary said, please accept Senator Fifield's apologies. He had cabinet business to attend to, so you have me. And I'm glad to see there are lots of familiar faces here today and also many new ones, and I look forward to the opportunity of us being able to acquaint ourselves. I'll do this. You'll do this. Thank you. I'm talking to the imaginary person up there. Thank you. I thought quickly we'd just have a look at how the National Disability Insurance Scheme is changing our world, and many of you will know that, so already know this information, so my apologies if I'm preaching to the converted. Obviously, we're looking at a nationwide demand-driven system of supports that are tailored to the individual with permanent and significant disability that has a substantial impact on their participation in everyday life. Once fully implemented, it's going to provide participants with certainty about their future disability support needs with genuine choice and control, which is really important for us, over how their support arrangements, what type of supports, who provides them and how and when they are provided. It's going to be driven by individual demand rather than by what's currently available through narrow responses to need. And the scheme is intended to be flexible so that it responds to changes in support needs as people's needs change. We've got legislation in place that sets out the provisions for supporting people with disabilities under the scheme, and it also has powerful principles and objects that focus on outcomes to be achieved and also how we're going to go about achieving those, and particularly how we go about achieving and providing necessary supports. With Western Australia having agreed to a 2-year pilot commencing the 1st of July this year, we're working towards a full national coverage, which is a mind-blowing piece of work, I'll just say. And the scheme will be implemented across Australia in a way that's portable, equitable and consistent for every single participant. So this was a slide that was corrupted. Okay, so if you can imagine, this is a map of Australia on this slide, and I would say to you, as you can see, there are 7 trial sites that are being established over the next 3 years. We've currently got trial sites established in South Australia, Tasmania, Geelong in Victoria, and also the Hunter, which is also Newcastle, in New South Wales. We're launching on the 1st of July, as is the Northern Territory in Tennant Creek. And Western Australia is also commencing a 2-year pilot from the 1st of July as well. Each of these 3 sites launching this year will be quite different, as you might imagine. So the issues and the dilemmas that we are facing here in the ACT are really different from those that are being tackled in Tennant Creek and Western Australia. The next slide that you would imagine you would see is talking about what our role is. So it's really about delivering the National Disability Insurance Scheme, which is described, for those of you who are curious, in the Intergovernmental Agreement for the scheme launch and inside our legislation. We've also got a role in ensuring the financial sustainability of the scheme. We have to make sure that individualised funding is reasonable and necessary packages of support are sustainable into the future. We have to provide innovative and flexible support to people with a disability. We're taking a lifetime view of support needs and are really wanting to look at ensuring a sustainable balance of costs and outcomes, and we need to report and advise on the financial sustainability. We want to develop and enhance the sector, not only the disability sector but our community more broadly. Obviously, we want to provide a whole lot of support about successfully transitioning existing sector providers into the new way of working. We want to also identify and tackle those barriers that are preventing providers from succeeding in the new world, and we want to build a sustainable sector and workforce. One of our other really important roles is to build community awareness about disability and the needs of people with disabilities. We obviously need to manage expectations of those people with a disability and their families and their carers who may have access to use their scheme in launch sites, but we also have a really strong moral obligation, I believe, to raise community awareness of disability and the social contributors to capability, and particularly to think about, for most of us in the room, the things that we take for granted are mostly not available to those people with a disability. So how do we, as a community, think differently about everything that we do and how we do it so that everyone is included? We also obviously need to collect, analyse and exchange data. We need to have a terrific IT system which captures robust data and produces reports. It would be true to say we've got a way to go at the moment, but that's our goal. And we want to be able to use that data so that we can promote awareness and make the information useful and valuable to the sector. And we also have a dream of undertaking research relating to disability and how supports support people most advantageous ways. And that's about sharing information and learning from successful participants, but also modelling future needs, looking at prevention and evaluating early interventions and supports. I'm hoping the next slide will work. Beautiful, thank you. So this is really about, I'm not going to read this out to you, but this is about how things are changing under the scheme. And if you can't read these screens, there's a couple at the back as well. So we're obviously looking at what the former system has been looked like and what it's going to look like under the National Disability Insurance Scheme. The primary aim of our scheme is really about increasing participation, and as you'll see, it's consistent with the United Nations Convention on the Rights of Persons with a Disability, and this is really about achieving full social and economic participation. It's a focus on individualised approach, and you'll keep on hearing that over and over again. Funding is linked to goals, aspirations and needs with an expectation that support outcomes can be addressed in flexible and participant-driven ways. And I guess also importantly, it's useful to say that the scheme isn't intended to fund, and nor will it in the future, those services and support systems that ought to be provided by other systems, so through mainstream services or through the community. And I guess the other thing I think it's really important to be commenting on is that we currently have 4 trial sites up and running with another 3 this year, and we are really clear about learning from each of those trial sites so that each and every time we're doing better than what we've done previously. So that does mean not repeating mistakes of other launch sites, but also making original ones, and I keep on chanting that as we are counting down the days to the 1st of July here in the ACT. The next slide talks about the 3 pillars that underpin our design, which is the insurance approach, choice and control, which you will hear a lot about, and community and mainstream. So clearly, this is a significant reform process. Some say this is as significant as a Medicare reform, and there are going to be huge impacts on our community sector. We're already noticing massive impacts for participants as we work with them to help them think differently about their lives. And just as significantly, or even more so perhaps in some ways, there are massive impacts for providers. And we know from existing sites already that many providers have struggled in the new world. Some have managed to alter the way they provide services and to think creatively about what services they might offer in the future, and some have failed. Some haven't done that nearly as well, and we're really, I'll talk in a minute about the work that we're going to undertake to support the sector, but it's really important that we support providers as best we possibly can so that this sector is as robust as it possibly can be. And I guess that, at the risk of stating the obvious, there are some very good reasons why we needed to change. So we're moving from a narrowly focused system where people weren't able to choose and have control over the services they wanted in their lives And for me, it's thinking about the things that we take for granted each and every day, that I can get into a taxi at 1 o'clock in the morning easily without thinking I'm going to wait for 4 hours, nor do I need to be worried about I can't stay out for dinner beyond 6 o'clock because my carer won't be, won't be at work for any time past 6 o'clock. So thinking about the things that I take for granted as the sorts of supports that we might want to be offering to participants. I'm not going to read that out. I'm presuming everyone can read that. So the impacts really are about, we're going to have a significant employment demand, and there are going to be massive opportunities as well in the disability sector. It's fabulous that the funding for the disability sector has almost doubled, but that actually also means that the workforce will need to almost double as well. And we're going to need a workforce that has the capacity to respond to the individualised funding model. And then the next one, please. Thank you. So the agency is really committed to working alongside providers to gradually provide the transition supports. We want to, in the trial sites that we're currently operating, we've been working really closely with providers to help them prepare for the new world, and then also as the 1st of July last year hit, thinking about what are the difficulties that providers were experiencing. And as part of that, those learnings, the Australian government has made a decision to set up a sector development fund as well, with the goal being to help the disability sector and the community and individuals get ready for this new way of delivering services. So the Sector Development Fund, and my apologies for the small type, is really set to drive change in the disability sector by supporting implementation of our scheme and ensuring people are able to be supported. And the National Disability Insurance Agency Board has agreed on the following priorities, which you can see there. So building community capacity, disability sector capacity, building capacity of people with a disability to participate in the scheme, building individual support capacity, aids and equipment, building workforce readiness, sector provider readiness, and on the next slide, there are the numbers. So over 5 years, the Australian government will be providing $149 million across Australia, not just for the ACT. The total funding for projects either completed or in progress to date totals about $91 million. And so we've got about $58 million available for future sector development projects, which is a significant investment. The next slide just talks about some current examples that are currently underway. The National Disability Service, the Mental Health Council of Australia, First Peoples Disability Network, and the Disability and Carers Alliance. In the ACT, some of the projects that are already underway, as you'll see, a commitment from the Commonwealth Government to spend $12 million on sector development in the ACT over the next 3 years has seen a whole lot of community capacity building workshops and projects underway. And you'll read that information there. The community capacity building projects, community awareness, the supported decision making and self-advocacy for people with psychosocial disability, building the capacity of families and other unpaid carers, and connecting the community, as well as other community capacity building programs. And the agency has provided a further $90,000 for expansion for the NDIS Readiness Assessment Tool project, and I wish that Stephen was there. The Sector Development Fund, we wanted to talk really about what our experiences have been from the other trial sites in terms of sector readiness. And as I said before, we're really focusing on how we can learn the lessons from the other trial sites so that we don't make the same mistakes but make new ones. The issue really, one of the things has been a readiness for management and staff and boards for the change to an individualised funding model and changing from that block-funded model that we've been accustomed to. Many existing providers are reluctant to make the significant changes or investments until they have a better understanding of what the full implementation is going to look like. It's really important for providers to have an adequate business plan or a strategic plan, and that they're thinking really, that you are thinking really proactively about the NDIS transition, because it will be happening very soon. An understanding of unit costs and how to accurately price a support type has been a challenge for some providers. Cash flow issues, particularly for small providers, and having enough working capital to operate over the billing cycle. And a need for providers to develop communication skills or marketing skills, whatever frame you want to put on it, with more emphasis on meeting client need or participants' needs, so that you can build and expand business. And we think that those providers who've got a larger proportion of their business focused on NDIS type business are going to be at greater risk than those who have a smaller exposure to this customer segment at this point. So the next slide, thank you. So just a couple more lessons learned. Really, we need the need to understand unit costs, and as we said, accurately price is going to be price a support type has been a challenge, and that's going to be really important. We're hearing stories of participants who are approaching agencies and asking for a quote, and an agency has been unable to do that. So the participant has then gone to another agency. Cash flow issues, as I said, the marketing and communicating, and really thinking about the business planning so that any particular vulnerabilities are tackled and addressed prior to NDIS starting. Thank you. So the Sector Development Fund that I'm talking about has got a number of proposed projects that fit with the NDIA board, and they're focused on building individual support capacity through disability support organisations, research that's focusing on the sustainability of the scheme, building community capacity and engagement with a focus on culturally and linguistically diverse groups, women, young people and people with a psychosocial disability, and building sector provider capacity. And depending on the project, providers will be selected either by restricted or open selection tender process. The future projects will really be, will go through the National Disability Insurance Agency Board for endorsement, and we're expecting there'll be a number of additional projects that will be initiated in the next few months. And depending on the project, as I said, we'll either go to a restricted or an open selection process. If you want more information, these are 3 ways that you can get the information. And I guess in summing up, I would like to say that we are really mindful of the challenges and the significant reform that the scheme brings to local communities, and the ACT is no exception to that. And we are absolutely determined and have a great passion to work alongside each and every one of you to make the transition as easy as possible, and for us to learn from all of the other launch sites so that we can do a whole lot better, and that we can learn together to make our community a better place for the participants for the scheme.